Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ria Tanwat Cotrillo. Today on the program, restrictions ease in Metro Manila and 7 other provinces under Alert Level 2 starting today. The government defends its new rules as inbound balikbayans and international travelers are no longer required to undergo quarantine. And an official believes the country is ready to remove the alert level system and granular lockdowns by March. OCTA Research Fellow Guido and health reform advocate Dr. Tony Leachon join us live. Some officials are urging the national government to begin the country's exit plan from the pandemic. This comes as Metro Manila and other areas ease to a less strict alert level 2. But is the worst really over in the fight against COVID-19? Let's go straight to the source of the story. Health reform advocate Dr. Tony Leachon joins us now. Dr. Leachon, good morning. Thanks for being with us here on the source. Okay, alert level 2. We're back to alert level 2 again starting today. What are your concerns, if any, about this change?
Well, Ria, the alert level 2 indicators right now are different from the indicators in December 16 of 31. If you remember, there were only less than 500 cases. In fact, on December 14, 238 cases, and the positivity rate was 2%. And then just yesterday, our total cases, 14,456, and the positivity rate nationally is 28.4%. And for some of the alert level 2 areas like the NCR, or you have 20%, and for Cavite, you have 27%, and then for Rizal, 30%. So basically, these are not indicators that usually you would do to downgrade to alert level 2. But of course, there have certain parameters like the average daily attack rate and the growth rate, which I think is very important. But basically, you still have very high cases here. And of course, I think this is a calculated risk of the government, considering that in the next few days, you have some important events. Like, for example, today you have holiday, you have the Chinese New Year, and then on February 9, you have the national campaign period rollout. And then on February 14, or a few days before, you have the Valentine's celebration. And these are potential mobility issues with the relaxation of the quarantine. At the same time, also on the new IATF resolution, in terms of the influx or inbound travelers that will be coming into the country. So you have here, more, I would say more indicators that the government is taking calculated risk to favor the economy more than the health of the people.
So what's your position, Doctor? Are you in favor of shifting to alert level 2?
I'm not against the economic goal, but I think it's too premature. I think we should have waited at least for a week to see the cases to go down, as well as the positivity rate, because of the potential variables that I mentioned that will increase the mobility and therefore the viral transmission. So my concern is about the timing. I would have, position it, let's say, or downgrade it 1 or 2 weeks, since by mid-February, we can see the lower risk, the cases to go down and be classified as the lower risk in mid-February. And I think that would be better, considering there will be no guilty feelings just in case you will actually reduce it to alert level 2. But right now, it's quite worrisome, knowing the cases right now is
right now 14,000. Quite high. Yeah.
Quite high. And the positivity rate, Ria, is very high when the WHO benchmark is less than 5%. This is really a stretch because 28.4%. This is still very high. and would mean really more viral transmission with the mobility issues in the coming few days.
Right. Well, speaking of mobility, you mentioned it earlier. There were a number of policies released by the IATF, and probably the most significant one, also starting today, is that returning fully vaccinated Filipinos no longer need to undergo facility-based quarantine. What are your thoughts on this, Dr. Leachon?
Well, the other countries are doing this, but we're in a difficult situation because we're the number one in terms of new cases in Southeast Asia, and we're still reeling from the Bloomberg Resilience Ranking at the cellar, in which we did not perform well in terms of the positivity rate and of course our vaccination rate. Now, of course, it is required that you have to have negative RT-PCR before the travel, and then there will be no facility-based quarantine, and then you go to your homes directly, and you will be self-monitoring yourself for the next 7 days. My deepest concern is with the high cases. We should have actually have a medical safeguard, like for example, a rapid antigen test within 48 hours, because we know that during the transit or the travel, you can still develop a virus, and that may actually cause some problems in the community. And knowing that self-regulation may not really be imposed, I would liken this to the Poblacion lady. That particular lady had a negative RT-PCR 2 or 3 days before the travel, and this particular lady went to the Poblacion and then developed asymptomatic and yet created the super spreader events with 12 people being affected. So if this particular situation will involve more people, the likelihood of some asymptomatic patients, bringing in the variants to our country, then this can create a super spreader events as well. So my main concern, Ria, is the lack of medical safeguard, knowing that the cases are high. And perhaps by putting in the medical safeguards in the next 2 weeks, and if we will find out that the yield is actually lower, then we can remove it. But it's quite worrisome that we're doing this to relax guideline, the IATF Resolution 159 for inbound travelers, and the imposition of the Alert Level 2, with a backdrop of 3 important events: the Chinese New Year, the national campaign rollout on February 9th, and the Valentine's Day.
Right. So there definitely are risks there. So you're saying that we need additional safeguards aside from being fully vaxxed and that RT-PCR test before passengers come in. What other, safety nets can we put in to ensure greater health for the public?
Well, the other countries are doing this. For example, in European countries, upon arrival, Ria, they will purchase a rapid antigen test, and then they will do this particular test within 48 hours upon arrival, and they will do this in their homes or in their hotel, and they will submit this to the authorities. So it's required. Now, without this medical safeguard in a country in which self-regulation is also wanting, so this may create problems. So what I'm trying to suggest is that still a medical safeguard like a rapid antigen test, which is not difficult to do, and the guidelines have been set up already by the Department of Health. Though medical access, it might be quite hard, so therefore I think it should be available at the airport so that the balikbayan or the traveler can actually do this at home and then submit it to the barangay captain or to the LGU, and so then observe that in the next 2 weeks or 1 month. Now, if this is not necessary because of the low yield, then at least we have done everything to protect our people, rather than do this in a cavalierly mode and then worry about the surges in the past, knowing that the indicators, our traditional indicators, the number of cases and the positivity rate are not actually on the side that it will actually create protection for the people. So that's my concern, Ria.
Yeah. If it were up to you, Dr. Leachon, kayo ba po babawiin nyo ang this no need anymore for non-facility-based quarantine?
Hindi na po. Kasi practice naman po yan ng ibang bansa na yung facility based kasi it deter po yung ang strategy is live with the virus. Kaya lang in other countries, Rhea, like sa Amerika, nag-live with the virus at saka Singapore, President Joe Biden launched this program na nagpapadala ng rapid antigen test to every American citizen, mga 4 na kids. Libre yon. So that hindi mo na, wala ka ng excuse, Rhea, for not doing the rapid antigen test kasi nandun na yung access. Ganon din sa Singapore. And testing is important to differentiate negative and positive. Kasi pag hindi natin ginawa yon, then we don't have the opportunity to segregate who's negative or positive. So at least you have this particular safeguard na dala-dala mo para sa ganun, kay negative or positive but hindi mo gawin, lalo na galing ka in an area outside of the country. And variants can come in, of course, not only here but also from other countries. So kung ako, Riyang tatanungin mo, okay lang naman tayo to favor the economy through this relaxation guidelines or relaxation of the guidelines. But let's not put in the medical safeguards to protect our people, to prevent the surge, and so that we will not lose the gains that we have generated the last 2 years. Sayang naman, going into the tail end of the administration of President Duterte, 100 days to go, and we don't want a surge coming into the election period.
That's right.
And this will really hurt us moving forward.
All right, Dr. Leachon, we will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Ria Tanwatco Trillo. Our source today, health reform advocate Dr. Tony Leachon. Doctor, welcome back to the program. We were talking about passengers coming in, no longer having to quarantine. Starting February 10, we will be allowing the entry of foreign tourists. What are your concerns around that?
Well, my concern is, of course, the immediate implementation coinciding with the imposition of the alert level 2. So you have potential risk of, bringing in passengers, lalo now in the absence of medical safeguards like a test within the 48 hours. And this particular situation coupled with relaxation of our quarantine to alert level 2 and the potential mobility issues with the Chinese New Year, and number 2 with national campaign period rollout on February 9, and of course the Valentine's Day. This particular IATF resolution plus the alert level 2 are potential issues that may actually increase the viral transmission, knowing that the cases still are very high at 14,000 yesterday, and the positivity rate for the national is 28.4%. But I understand, but in Metro Manila, the positivity rate is 20%, lower but still high, based on the benchmark of the WHO, less than 5%. So, this is a calculated risk, Ria, and I think the primary rationale for this is leaning towards the economy, and we need to be empowered and be self-aware not to get the virus. And so we need to, master the usual pillars and cornerstones of curbing the pandemic, which is actually testing, tracing, isolation, quarantine.
Right, some of which you mentioned earlier, including self-test kits. Doc, binanggit nyo yan kanina. And the DOH has released its guidelines. It's approved at least 2 brands. Do you feel the public should have greater access to testing? Should the government, or even can the government, give testing kits for free like what is being implemented in many other countries?
I think we should have done that, considering in our country, ang problema mo, Ria, is the prohibitive cost of the RT-PCR. And even with the rapid antigen test na kauumpisa lang natin, it will be very difficult for kababayan, particularly those who are actually on those mga wage earners na wala, doon tayo nagkakaproblema because of their spaces na maliliit. So kung mapoprovide natin sila through barangay, mas okay yun eh. Kasi yung nare-reflect Ria sa DOH ay RT-PCR lang. At hindi mo naman alam Ria because of the absence of the access kung gagawin yan kasi wala kang access eh. So how much more kung hindi natin siya bibigyan ng libre. So maaring underreported to Ria na cases pa natin ito na 14,000 or maaring dito sa NCR na 4,000 ang cases natin, maaring underreported to. Kasi hindi kasama dito Ria ang rapid antigen test. Yun lang ang worry ko na we're taking a relaxed mode despite the worrisome numbers that we have in the country. So sana lang ilibre lang natin sana ang rapid antigen test kits. Lalo na doon sa mahihirap nating kababayan. The middle class and upper class, I think meron sila at saka sa workplace sila. But I think the lower economic strata, dapat man lang ma-provide natin ng free rapid antigen test kits.
All right. Now, another thing, Doctor, is Presidential Advisor Joey Concepcion. He says that the government can do away with alert levels in the coming months. What are your thoughts on this? Do you support it and the call to begin preparing a pandemic exit plan?
Well, that is the way to go in other countries, no? You need the pandemic exit plan. But I think what is important here is that the viral transmission should be controlled. That's the first one. And we know right now, hindi pa masyadong controlled eh. Number two, the healthcare capacity should be in place, like in Singapore and other countries. Kaya the other countries in the Bloomberg Resilience Ranking, umangat na kasama doon ang Taiwan at kasama ang South Korea, nasa top 10. And then yung mga dati nasa cellar, like Thailand and Malaysia, went up to number 26 and 27. Pati Hong Kong and Philippines, naiwan sa cellar. You know why? Because we have not improved on our healthcare capacities. Our positivity rate mataas dahil hindi tayo nagbibigay ng free access to the rapid antigen test. Lately lang tayo nag-consider and we were scrambling, Ria, for the rapid antigen test during the first 2 weeks of January and nag-out of stock na ang mga medication. It's basically dun sa problemang yun eh. So if you really want a pandemic exit plan, I think the business sector or the business community should actually pursue as well that the government should improve the healthcare capacities eh. And that is being done in other countries. That's why they are successful in terms of their pandemic response. Nakalimutan natin yung playbook eh. Like testing, tracing, isolation, quarantine. Ria, you cannot isolate and you cannot do contact tracing without testings. And if this is not accessible to our countrymen, then we'll actually induce more viral transmission. Yun ang key dyan eh. And I think I reviewed already the performance of other countries. Kaya hindi tayo makatanggal sa cellar. 3 out of the 5 readings in the monthly snapshots, nandun tayo sa bottom because we have not addressed the metrics or the indicators eh. And we cannot manage what we don't measure. And I think it's about time that we take a serious look at the indicators so that we will be successful in terms of our pandemic exit plan.
All right. We cannot manage what we cannot measure. Thank you for your time this morning, Dr. Tony Leachon. Up next, we'll be speaking to OCTA Research Fellow Guido David. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, OCTA Research Fellow, Professor Guido David. Professor, good morning. Thank you for joining us here.
Yes, hi, good morning, and happy Chinese New Year. Yeah.
That's right, Kung Hei Fa Choi. Now, Professor, we've seen declining cases of COVID-19, and you even said that the worst may be over in some areas. Why is that so? What patterns are you seeing?
Well, of course, trends can still change. What we're just saying is that the worst may be over, meaning that the peak has happened. Peak of the surge has happened in many of the areas. Of course, that this includes NCR and all of Calabarzon, which is now under moderate risk. This also includes Central Luzon. Actually, most of Luzon is probably on a decreasing trend already, or a downward trajectory. This also includes Cebu City, which is already having a decrease in cases, and Davao City. So the areas wherein the surge is still accelerating, there are only just a few of them. So what we mean by the worst is over, that the peak has occurred. And if we think of the peak of the surge as being the worst part of the surge, or being the most destructive, then that part is over. Of course, that is based on the premise that there will be no change in the trend within the next few weeks.
All right, I want to talk about the situation here in Metro Manila. There was a slight uptick in cases a few days back. To what would you attribute this? Was it due to backlogs, or was it really a resurgence? And for Metro Manila, we have reached our peak already, right?
Right, we have reached the peak, Rhea. The peak was back in January 15. We were still at 18,000 cases, and we were down to about 2,000, averaging about 2,000. And a few days ago, we had 3,000. It could have been just a random uptick due to backlog. Yesterday, we had another random uptick of about 4,000 cases in Metro Manila. It's a little uncharacteristic. Right now, I would attribute that to backlog. Unfortunately, we don't have complete access to the data of the Department of Health. But why am I why am I attributing this to backlog? Well, the positivity rate is still decreasing. It's now down to 17%. Hospital care utilization is also decreasing. There is no indication that there would be a resurgence in cases, and we're also seeing some local government data wherein cases are still decreasing or in the downward trend. Having said that, I wouldn't rule out completely the possibility that an uptick could occur or maybe occurring. So we'll have to wait for a few more days to really look at the data if it continues to have these random upticks in cases.
Right. Now, in the past, you've said that, the numbers that we're looking at during this Omicron surge are probably significantly lower than the number of cases that there really were, as there were many underreported cases, people not getting enough testing and just assuming that, they had COVID-19. Of that number that was not reported, how significant is that number? And if we did have a more accurate picture, would this impact the decisions that are being made now?
Well, we're trying to estimate what the true scale of the pandemic is. We have learned in the past that the scale of the pandemic is actually higher than what we perceive it to be, meaning that the number of reported cases is definitely lower than the number of actual transmissions. So just to give you an example, back in March of 2021, when we see the Philippine Statistics Authority data on excess deaths, what we see is that it was actually 5 times higher than what was reported. So that seems to lead to the possibility that the scale of the pandemic was about 5 times higher than what we saw. Now, in this regard, it is actually very important that we see random.
All right, Professor, are you there? Okay, we were speaking to Professor Guido David of OCTA Research there. It seems there was a bit of a problem with his line. Let's try him again. Professor, go ahead, please.
Hi, Ria. So I hope my connection is fine now. So
Yes.
Yes, I was mentioning about the random antigen testing conducted by DOTR. We're happy that they're doing that back in January 12 to 13. Based on our statistical estimates, and again, these are just estimates, we noted that the scale of the pandemic is about 10 times, possibly 10 times higher than what is being reported. So what that means is if we're seeing, let's say, 18,000 cases a day in the NCR, the true number, including unreported cases and home test kits, would be about 10 times higher, or about 180,000. But now, based on the same survey conducted more recently, January 26 to 27, the positivity rate for random testing has decreased to about 0.5%. So now the scale that we're estimating is about just about twice the numbers that is being reported. So if they're reporting 2,000 cases daily in the NCR, that would translate to about roughly 4,000 actual cases if we include antigen test kits and unreported cases.
All right, can you tell us, Professor, about other regions or provinces of concern that are just now experiencing their surge in cases?
Right, Ria. And I mentioned that most of the country is now has actually peaked in terms of cases or are now on a downward trend. But those that are still seeing a significant positive growth rate, which means that there's still considerable transmission, include Bukidnon, Camiguin, Cotabato, Davao de Oro, Davao del Norte, Davao Occidental, Davao Oriental, Maguindanao, Negros Oriental, Sarangani, South Cotabato, Sultan Kudarat. So I will note that only Negros Oriental is from the Visayas region. Most of the provinces are from Mindanao, and none are in Luzon. So I noted that most of Luzon is probably already on a downward trend.
All right, we're also getting reports about the Omicron subvariant. Some are saying that it is possibly more transmissible. Do you see this becoming a problem within the next few days and weeks?
Well, Ria, one of the other things I did, and I presented this yesterday in the Pandesal Forum, was that based on the reproduction number that we measured in different provinces, we at least have some idea that the BA2 subvariant has probably already caused transmission or undergone transmission in many areas all over the country. In fact, that includes NCR. And in fact, most of Luzon is may have already been affected with the BA2 subvariant. So right now, because it has already entered the country and has already caused a transmission in many places, it's no longer a major concern, in my opinion, because we have essentially attained some level of population immunity against Omicron, especially in the areas where we're seeing now a downward trend. The reason for the downward trend is not just the interventions and what we do, but also we have achieved some level of population immunity against the virus.
All right, Professor, thank you so much, as always, for your time this morning. That was OCTA Research Fellow, Professor Guido David. And thank you for joining us here on The Source. I'm Ria Tanwat Cotrillo. You're watching CNN Philippines.